What are respiratory droplets and how do they spread flu? Respiratory droplets are tiny liquid particles that come from our bodies when we cough, sneeze, talk, or even breathe. These droplets can carry viruses, including the influenza virus if the person is infected. Typically, these droplets are larger than 5 micrometers in diameter. Because of their size, they usually travel only short distances, generally less than 6 feet, before they fall to the ground or settle on surfaces. When an infected person coughs or sneezes, they releases these respiratory droplets into the air. If someone nearby breathes in these droplets, or if they land on their nose, mouth, or eyes, the influenza virus can enter their body and cause infection. This is known as direct transmission and usually happens when people are close to each other. After droplets settle on surfaces, they can still be a source of infection. The influenza virus can survive on various surfaces for hours to days, depending on the material and environmental conditions. If a person touches a contaminated surface and then touches their face, especially their nose or mouth, they can transfer the virus to themselves. This is called indirect transmission. There are also smaller particles, known as aerosols, which are less than 5 micrometers in size. These can remain suspended in the air for longer periods and travel further distances. While droplet transmission is the primary way influenza spreads, aerosol transmission can also play a role, especially in enclosed or poorly ventilated spaces. Influenza viruses prefer to infect cells in the upper respiratory tract. They attach to specific receptors on the surface of respiratory cells, which helps them enter the body after exposure to infectious droplets. Environmental factors like humidity and temperature can affect how long the virus stays infectious in the air or on surfaces. To reduce the spread of influenza, it is important to practice preventive measures. Physical distancing, wearing masks, practicing good hand hygiene, and regularly cleaning surfaces can help limit exposure to infectious respiratory droplets and contaminated surfaces. In summary, respiratory droplets are the main way influenza spreads. They can transmit the virus directly through close contact or indirectly via contaminated surfaces. Smaller aerosol particles may also contribute to the spread, particularly in certain environments. Understanding how these droplets work is crucial for controlling influenza transmission and protecting public health.